If your child has just been diagnosed with autism spectrum disorder, ASD, your emotions are most likely in a disarray. You might not know what it is and what it means for you and your child's future. Humans are fearful of the unknown, so it is obvious that learning as much as you can about this disorder will help you ease the fear and confusion. We understand that there are a lot of decisions and questions that are occurring in your day-to-day life, often overwhelmingly. We all make mistakes, they're part of being human. However, that is precisely the incentive for the development of academic texts and media, in order to educate the general public. No matter what, you will have self-doubt and many questions. This video will help you discern between the two primary treatments that are available for your child, Ayurvedic and Western treatment. In this documentary, we will cover the following content: causes and symptoms of autism, the advantages and disadvantages of Ayurvedic and Western treatment, and the effectiveness of the respective treatments. Understanding the cause of autism spectrum disorder is crucial to finding a method of treatment that may work best for your child. But finding that specific cause is not particularly easy, as there are countless combinations of factors that could work together to affect your child. Western and Ayurvedic professionals have varying beliefs on the causes of ASD. In Ayurveda, it is believed that the main cause of autism is the mother's diet and regimen. Before and during conception, depending on the state of the mother's mind, food, and daily regimen, the child is affected. This is according to Dr. Shankar Prasad Musath, who is an esteemed graduate of a Bachelor of Ayurvedic Medicines and Surgery from Illam Ayurveda Heritage. On the other hand, Wendy Chung, a passionate speaker on autism, gave a speech on TED Talk. There's probably not one single answer. Just as autism is a spectrum, there's a spectrum of etiologies, a spectrum of causes. Based on data, we know that one of the causes, is advanced paternal age. In addition, another critical period in terms of development is when the mother is pregnant. During that period, while the fetal brain is developing, we know that exposure to certain agents can actually increase the risk of autism. In addition to that, there are about 200 to 400 genes that may work in an intricate combination to induce ASD. There is a fervently held belief in Ayurveda which suggests that a chemical agent within the vaccinations are the cause of this disorder. But it has been proven by the Institute of Medicine that there is no credible evidence that vaccines are the cause. More specifically, a component of vaccines, something known as thimerosal, was thought to be the cause. It was removed in 1992 and has been determined that it does not have an effect on the prevalence of autism. As you can see, Ayurveda and Western medicine point to different routes. Signs of autism in children vary depending on the circumstances of each child, predominantly where each child is situated on the spectrum. Abnormal facial expressions, tone of voice, poor eye contact are some of the symptoms that are mainly displayed in children with ASD. Usually, parents like you notice these delayed milestones, and when checked, your child will be diagnosed by your pediatrician. If you have any concerns about your child's development, see your pediatrician as soon as possible. Knowledge of life, or as it is more commonly known, Ayurveda, dates back 5,000 years, making it an almost timeless healing system. Also claimed to be the most ancient holistic healing system, Ayurveda is a traditional system of medicine originated in the Indian subcontinent. Ayurveda is one of the most prominent methods utilized in treating ASD in children. The first line of treatment is the defense of the cause, discontinuing the interaction between the root cause and your child. It is believed that in Ayurveda that the main three qualities of a human being are intelligence, memory power, and coordination. Children with ASD usually lack coordination, and coordination is the link between the two, like glue. The other two parts, intelligence and memory power, are incapable of highly functioning without it. Ayurveda believes in the back to nature concept. Half of the treatment for ASD in children is done in nature. Your child must be able to recognize the detrimental objects in their environment. The entire concept of the child in nature idea revolves around the development of your child's survival mechanism, which immediately informs themselves of any harm in their surroundings. For example, he or she should be able to recognize the thorns on a rose, which may appear at first beautiful to them, but are in fact harmful to touch. The other half of the treatment is equally split into the utilization of medhya drugs and your involvement in your child's development. Your child will react to your encouragement with a significant enhancement of their emotions, which will bring out their characteristics. Another rudimental aspect which takes part in the treatment of autistic child is God's grace, also known as karma. In Dr. Shankar's experience, a child is capable of improving in 2 to 3 years of starting the designated treatment. With no question as to the moral fiber of Ayurveda itself, there are some widely implemented treatments in Ayurveda which may cause great harm. In general regard, the Journal of the American Medical Association completed a study in 2004, which analyzed the most widely accessible Ayurvedic drugs. Out of the 70 drugs they had found, a significant 14 drugs was discovered to have harmful levels of lead, mercury, and arsenic. The main hazard with Ayurvedic drugs is the prevalent ingredient of metals, and in some cases, poisons. This can cause nausea, giddiness, staggering, weak pulse, and labored breathing. However, with specific consideration to autism, Ayurveda uses Mandukapparani, Yastimadu, and Guduchi. Mandukapparani is used mainly for autism to help with treating the child's intelligence and memory power. When taken by mouth, the drug can cause nausea and stomach pain. Rarely, it may also cause liver problems. When used on the skin, it may cause itchiness and redness. The side effects of Yastimadu are lethargy, weakness, swelling, paralysis, headache, and high blood pressure, among others. The main side effect of Guduchi is low blood sugar levels. Please note that there has not been sufficient scientific research upon the individual profiles of these medhya drugs. Western medicine, despite its reputation as an evidence-based medicine, is not empty of side effects. Due to its heavy contact with bodily hormones, it is also very prone to affect bodily functions in some way, regardless of the extent of the impact. The holistic system of Ayurveda uses not only drugs but also therapies to prevent autism in children. Panchakarma is a fivefold therapy which uses a variety of ingredients and techniques to detoxify the marks left on the body by disease, malnutrition, and the environment. However, despite its beneficial qualities, the therapy has the following side effects: fatigue, malaise, headaches, congestion, and mental disturbances. Snehana, also known as oleation, is a specified rubbing of the medicated oils or ghee on the body. The side effects include loss of appetite, thirst, drowsiness, and bodily pain, among others. Nasyam, also known as nasal therapy, is the administration of medicine such as juice extract and oil through the nasal route. Nasyam therapy is known to have very few complications associated with it. Western medicine is a name which is used to describe evidence-based medicine, which historically originated from Western civilizations, primarily Europe, although now it is practiced globally. Western medicine is a rival of Ayurveda and also treats ASD in children. Western medicine, much like Ayurveda, employs a variety of trusted techniques in order to treat ASD. Wendy Chung stated that the substituent components of the treatment plan are drugs and educational strategies. Since there are no drug targets, drugs are utilized solely to counteract the symptoms your child has felt. In order to do this, we have specified educational strategies. Behavioral interventions focuses on teaching children new behaviors and skills using specialized and structured techniques. These techniques are the best teaching tools for developing skills and encouraging appropriate behavior. Developmental interventions aims to help children form positive, meaningful relationships with others. Focuses on teaching children social and communication skills in everyday setting. Combined interventions combine elements of behavioral and developmental methods. Often it is the most effective for the child as it brings together characteristics of other good interventions. Family-based interventions emphasizes the concept that family involvement in therapy is central to meeting child's developmental needs. The effectiveness relies on addressing the needs of the whole family, so everyone benefits and not just the child. Therapy interventions provides a specific therapy that targets specific difficulties, such as occupational therapy and speech therapy. These approaches are often used together with other intervention programs. Further information on these can be obtained via your pediatrician or even online. When it comes to autism, Western medicine offers 3 primary drugs, which are used to prevent unwanted social symptoms that arrive together with autism. The drug is called aripiprazole, which is popularly marketed under the brand name Abilify. Abilify can be used for a variety of audiences, and it serves the purpose to cease behavioral outbursts like mood swings, irritation, temper tantrums, and self-injury, which may support your child. Risperidone, marketed under the brand name Risperidol, is an antipsychotic medicine used similarly to aripiprazole to treat irritation and irritability. The next drug, generically called venlafaxine and marketed under the brand name Effexor, used to treat depression, anxiety, and panic. These drugs are not given to every child with autism. As always, it is best if you check with your pediatrician to see what would best suit your child. Please remember that autism is a spectrum disorder, and every child will vary from one another depending on where they are situated on that spectrum. So what works for them and their child may vary vastly to what may work for you and your child. For example, Mr. and Mrs. T have a child aged 10 and he has been placed on the autism spectrum disorder. The family initially tried the Ayurvedic treatment by consulting an Ayurvedic practitioner in Sri Lanka. He recommended some of the Medhya drugs for their child. On the plus side, there were no side effects evident. However, there were also no improvements of any sorts. They decided to turn to Western treatment. The professionals suggested he go through educational therapy, and he currently goes to a specialized school for children with ASD, where there is occupational and speech therapy available for the children present. From our observations, we believe that Western medicine is in the long run more beneficial for your child. However, it is entirely up to you to choose which treatment would be best for your child depending on your family situation, your child's needs, and your beliefs as a family. Understand that Ayurvedic and Western treatment are not the only methods of treating autism in your child. There are other treatments that may be as effective when compared to Western and Ayurveda. You can learn of these treatments through your pediatrician and even some personal research online.